Hi, I'm Dr. Castanet. Today I want to talk to you about my typical topic, which is the cause of neck and back pain generally. But I want to tell you about the natural history of the spine and why you have neck and back pain intermittently over the course of your lifetime. I've explained before that generally the degenerative process starts with degeneration microscopically of the discs, which starts in the center of the discs as we're younger, and because the center part of the disc is not innervated, you don't feel the degenerative process, and you don't associate the physical demands and things you do as a kid with injuries to the disc. As you get older and the injuries and degenerative changes accumulate, it'll start to involve the more peripheral or outer fibers of the disc, and that's when you first experience back pain. As the discs degenerate, the discs which function as shock absorbers between the vertebrae of the spine and the neck and low back and middle back area, they slowly collapse like this. That puts more pressure on the joints, which can be pain generators, and eventually, as a result of associated disc bulging and herniation, and a smaller canal that happens, as we get older, all of those things can then put pressure on nerves, and nerves can become a source of pain. So the three common pain generators in the neck and the low back are discs, joints, and nerves, generally in that order. When that process happens, and when there's intermittent pain, the perception of your body and spinal cord and brain results in a reflexive, protective muscle tightening. And the muscle tightening is very perceptible. In fact, very often the cause of the pain is ascribed to muscle pulls and injuries to the muscles, which is a misconception. Muscles are simply doing their job to protect the region and splint the region and guard so that you don't further risk injury of that injured tissue, whether it's disc, joint, or nerve. But in any case, over the course of our lifetimes, as this degenerative process proceeds, it lowers our threshold for provoking pain from different activities of daily living, so that it's easier to injure your back or your neck from maybe a sleep posture in your neck, or bending over and doing something, sometimes even something very trivial, that stresses this slowly degenerating spine. Very often a component of treatment will be strengthening, and the rationale for strengthening your neck and the back is as follows, and I'll move on to another point that's relevant here. The joints and bones throughout your body are connected by ligaments. The function of ligaments is simply to tie bones together, and at many of the joints between bones there's a joint with synovial fluid, but the ligaments themselves are intrinsically very, very weak, and they don't provide significant protection against injury of the ligaments themselves, or discs or joints. So to provide protection of these tissues, you have muscles, and the muscles protect by splinting, which is relevant to the earlier point I made about the reflexive contraction or guarding or splinting of muscles that happens as a result of injury. But in the course of your physical demands, the way to protect joints from injury, because these joints are so mobile and so vulnerable to injury, is to consciously splint and use your muscles to protect joints. So during the course of your physical demands, during the day, in order to protect your joints from injury, you need to consciously use the muscles to splint whatever joints are involved in whatever physical demand you're doing. So, for example, in the low back, if you're going to bend over to get something, you want to consciously take a deep breath in, and you want to bear down and hold your breath. What that does is it drops your diaphragm, compresses the contents, your abdominal pelvic contents, and provides a rigid cylinder to protect the spine and back. Of course, to be effective, you want as strong a set of core muscles as possible, so that when you take the deep breath in and drop your diaphragm and compress the air and the contents of your abdomen, there's a rigid wall provided by the core muscles. So that's the rationale for strengthening your core muscles. How to do that is another topic we can discuss. If you're really interested in strengthening your core, you can do so with probably Roman chair exercises, at least for the low back muscles, and perhaps deadlifts. But to do those safely and effectively, you need some instruction. And you can actually find some instruction on YouTube from a number of good sources. There are even a couple of physicians on YouTube that are fantastic. They're both power lifters and medical physicians, and their YouTube channel is Barbell Medicine. So if you want to learn about a proper technique and be disabused of any fear you have of doing strengthening exercises like deadlifts, I encourage you to check out their channel. They're absolutely knowledgeable, both didactically, through book knowledge, and practically through their powerlifting experience. They're absolutely fantastic. But let me move on. I want you to get the concept that your degenerating spine has a lowering threshold over your lifetime for exacerbating symptoms and aggravating injuries in your low back and causing injuries in your low back. So you want to be as strong as possible, to be as effective as possible at protecting your spine and your joints. That's true for your shoulder, your back, your neck, all of your joints. They're exceedingly vulnerable to injury, and the only significant, meaningful protection you have against injury of your joints in your lifetime is through muscular effort. And that's why it's so important to maintain strong muscles. And coincident with this degeneration and decreasing threshold, lowering threshold for injury, is the usual age-related sarcopenia, or loss of muscle mass and strength as we get older. So it requires a deliberate, informed, and competent effort on your part to strengthen your muscles if you want to minimize your episodes of pain in the neck and back and otherwise. So I have other videos that I'm going to provide on strengthening, but in the interim, I encourage you to go to Barbell Medicine and listen to those doctors provide a rationale for strengthening. And strengthening is neglected by most physicians because they don't have any personal experience with it. Most physicians, in fact, most people, don't have a particular interest in strengthening because it's hard work, requires character, and in my opinion, that is in short order. Most people that go to gyms don't do significantly demanding activities that would strengthen their neck and the back, and we pay a lot of lip service to that, but to really strengthen it meaningfully, you've got to do things like Roman chair exercises and ideally deadlifts. So that's it for now. If I can help you, give me a call. I'm in Decatur, Georgia, 404-558-4015. And thanks very much. Bye-bye.